always grateful for opportunities to talk about challenges and opportunities of healthy aging and the contributions that each of us can make to meet them. I hope I can add a useful perspective today. I get to speak to you as a nurse and as the National Volunteer President of AARP. Our founder, Ethel Percy Andrews, believed older Americans had so much to contribute in ability, in experience, and in a desire to advance the public good, and likewise, that society had much to gain from its oldest citizens. She said, "We live in a country where it's wonderful to be young." And 60 years ago, she said, "It's time we create a country in which it's wonderful to be old." We're still working on it. In the midst of a titanic population change. In 2014, the youngest baby boomers, they don't want to admit it, but the youngest baby boomers turned 50, and we sent them information. That generation is now 78 million strong. By 2030, the number of older adults in the United States will nearly double. 1 in 5 Americans will be age 65 or older, and the fastest growing age group in this country is made up of those over 85. So you got a lot to look forward to. 10,000 people are turning 65 in this country every day. And the actuaries at Social Security say that 1 in 4 of them will live beyond 90, some of them for many years. Today, a child has a better than 50% chance of living to 100. We might have 1 million people age 100 or over by the year 2030. In fact, experts are saying that a child who will live to be 150 years old has already been born. In many ways today, it is wonderful to be old in this country. Many older people are having the time of their lives, and many more could be. Many of us will remain active, vigorous, and creative, working longer if we want to, playing longer, and taking the American economy in a new direction. Greater longevity is a huge gift, but unfortunately, its benefits are not enjoyed by everyone equally. We're going to need help to make that happen. The report that's being released today confirms a stubborn truth. Health disparities exist across ethnic, racial, socioeconomic, and geographical lines in the United States, often in defiance of more promising trends that affect the population as a whole. Minorities have fared worse in health and healthcare throughout their lives, and it will continue to be more challenged as older persons. Notable, a lower life expectancy, poorer dental health, more asthma and COPD, hypertension, stroke, HIV/AIDS, cancer, cardiovascular diseases, diabetes, and cirrhosis of the liver. They're less likely to have insurance, and they rate their own health status as low. One study found that Black Medicare, and I'm not saying Medicaid, I'm saying Black Medicare beneficiaries are 35% more likely than whites to be admitted to hospitals that have high mortality rates. On the care front, minorities are historically underrepresented in clinical trials. There's a dearth of minority bone marrow donors and an especially long waiting list for transplants, twice as long as Caucasians for kidney transplant. Racial and ethnic minorities are also woefully underrepresented in the health professions, and among those currently training to work in the health profession. It's gotten a little better, but it's a long way to go. Yet, a patient's satisfaction and understanding of the prescribed treatment regimen and willingness to comply with their health providers' orders increase when patients and care providers share a similar ethnicity and linguistic background. Si usted no habla español, es muy difícil para hablar con una persona de idioma. See, if you don't speak that language, how do you speak to them, right? My grandma was Spanish. Among practitioners, stereotypes and biases are often unconscious, but it can influence decisions about treatment. Experimental studies demonstrate that providers presume that minority patients are more likely to abuse drugs or alcohol, be less educated, et cetera, et cetera. So I'm looking forward to hearing about the health disparities from Michigan in this new report. But trust me, the gaps are nationwide. So going forward, we will need a healthcare system that offers not only better access and high quality care, but a system composed of providers who recognize the individuality of their patients and who reflect the people they serve. This will be a team enterprise. Working together, a healthcare team can replace a potentially bewildering, sometimes dehumanizing experience with care, with one that is now will be affirming and coordinated. Teamwork lends itself to a more complete picture of the individual. Are there needs for nutrition, recreation, or long-term services and supports that are not being addressed? Is the person isolated? Is the person depressed? The whole team has a role in answering such questions. Allow me, I'm a nurse, so I always have a soapbox to be on. So I think nurses are a critical factor. I'm one of the pieces of the team. And they've proven to be essential team members and team leaders. AARP has been a long-time loyal advocate for expanding the role of nurses. This is especially true in rural and urban communities where primary physicians are scarce and antiquated laws stand in the way. But Melissa told us that Michigan removed the restrictions and advanced practice nursing. So much of what affects health and well-being are socially determined, including factors like poverty. And poverty is not an individual's problem, it's a system problem. Food insecurity, smoking, drugs, homelessness, isolation, and violence. Social determinants are the unmet social needs and can lead to preventable health conditions. Differences in the distribution of these influences are a big contributor to gaps in health outcomes. Any one of them can block individuals from getting what they need. Therefore, if we are to create a culture of health that is enjoyed by all, we have to address these social determinants of health and the disparities and the inequities in our society that are lowering the quality of life for so many. In fact, studies show that as many as 15% of preventable deaths can be attributed to the social determinants. AARP and AARP Foundation are ardent partners in wrestling with the social determinants of poor health to create a culture of health. The social determinant lens opens our eyes to the conditions in which people are born, in which they grow, in which they live, in which they work, and also how they age. It enables us to see the connections and causality that can be easy to miss. From this vantage point, health takes on a far more expansive meaning than simply healthcare. Unemployment, substandard housing, crumbling neighborhoods, and food insecurity become health issues? What if in our debates about healthcare, we grapple not only with the critical questions of coverage, quality, and affordability, but also with the social factors that so clearly affect health? Again, these various factors roll up into that one main determinant, poverty. As I noted before, poverty is a health issue not only for individuals, but for our society. It's a societal illness. Yet so often, we see it as an individual's failure rather than a system problem. It's corrosive, it's expensive. Ask somebody who's struggling to pay their loans. You guys don't pay their loans? Or who have just emerged from a cycle of evictions. Someone who's trying to cope with a high cost of food in food deserts. Someone who is just living from paycheck to paycheck. Poverty feeds on itself. A study published in Health Affairs, I want you to listen closely, found that poor women who undergo breast cancer treatment are 4 times more likely to lose their jobs than high-income women with the same condition. The goal of healthcare reform and the aim of work we're doing at AARP is person-centered standard of care, in which an individual's goals and preferences are treated as paramount. Individuals should feel empowered, know what their choices are, and feel connected to their healthcare providers through clear communication and understanding. You do understand that poor communication from provider to patient is the most common reason patients do not take their medications as prescribed. All the providers in this room can tell you. Patients deserve to feel that their personal dignity and their wishes are a top priority. They should be made to feel that they and their caregivers are members of the care team. Communication is the key. Each of us has the power to help AARP's founder, Ethel Percy Andrews, who fought hard to change minds and to create new reality. She knew the power that one individual possesses, but she also recognized the force of collective action. We're still facing many of the same battles. Battles we seem to have to fight over and over. I ain't tired yet, I'm still fighting. We have the opportunity to help create a culture of health from which every person benefits, and which it is wonderful to be young, but it's also wonderful to grow old. We need to follow Ethel's example and use our individual and collective power to bring about the changes every American wants and deserves. Thanks for inviting me.